Scene Size Up, Chapter 11. The elements of scene size up include checking for scene safety, taking your standard precautions, and noting the mechanism of injury or nature of the patient's illness. You're then going to need to determine the number of patients that you have and that you're going to need to treat, and decide what, if any, additional resources may be necessary at the scene. Remember that the only predictable thing about emergencies is that they are often unpredictable and they can pose many dangers. So scene safety is going to need to be reevaluated throughout the entire call. So as you near a collision scene, you need to look and listen for other emergency units approaching. Look for any signs of a collision-related power outage, such as down power lines, broken poles, or anything like that. Observe the traffic flow. Look for smoke in the direction of the collision scene. When you're within sight of the scene, look for clues that indicate escaped hazardous materials. Look for collision victims on or near the roadway. Look for smoke that's not seen at a distance. And look for any broken utility poles or down wires. Also be alert for persons walking alongside of the road towards the collision scene. These may be bystanders, or these also may be patients. Watch for signals of police officers and other emergency personnel so that you know where to park your ambulance, fire truck, or whatever you're responding in. As you reach the scene, make sure you're following instructions of the person in charge. Don any appropriate protective apparel, including any sort of head protection, a bunker coat, bunker pants, any sort of ANSI-approved reflective vest over top of your coat. Establishing a danger zone. So around the wreckage of every vehicle collision, there could be dangers that we need to be mindful of. The specific guidelines are, when there's no apparent hazards, extend at least 50 feet in all directions. When fuel has been spilled, we want to extend that to 100 feet in all directions from the wreckage and the fuel. If a vehicle is on fire, at least 100 feet in all directions will be the danger zone. And if you've got wires down, you want one full span of wires away from the poles to which the broken wires are attached. When a hazardous material is involved, you want to check and refer to your Emergency Response Guidebook, or ERG. Evaluate for the threat of violence. Do you hear fighting or loud noises? Are there weapons visible or in use? Do you see any signs of alcohol or drug use? Is there unusual silence when you would expect somebody to be speaking, screaming, crying, or anything like that because of their illness or injury? Are you responding to a place where there's been prior violence before and you may need police assistance? So think about it. Although any call can present a potential safety hazard, what types of calls might pose the highest threats to potential violence? Standard precautions. We refer to this as BSI, or body substance isolation. There's also personal protective equipment, or PPE. Body substance isolation will help keep fluids out of areas that fluids shouldn't be and help keep your hands clean, such as gloves, masks, goggles, and things like that. Your personal protective equipment are things such as helmets, coats, bunker pants, anything that will prevent injury while you're on scene. So the nature of the call. Why has EMS been called? This is either going to be a mechanism of injury, as in trauma cases, or a nature of illness, such as medical cases. The assessment of the mechanism of injury will help the EMTs identify injuries that are common to particular situations, and they're going to be able to help you focus on the assessment and key life threats. Mechanism of injury can include forces that cause the injury, so you want to make sure that you have an understanding of forces so that you can be able to predict an injury pattern. This can be very useful in predicting injuries associated with certain types of motor vehicle crashes. In this particular case, we've got extensive windshield damage, so we can suspect that our patients may have some sort of head, neck, or spinal trauma. Motor vehicle collisions. You've got head-on collisions, where you can likely see an up and over injury pattern, as in into the windshield and up over the dash, or your down and under injury pattern, in which they're going to go underneath the dash. Both of these are going to yield different types of injuries. Clues such as deformed steering wheels or deployed airbags may also lead you to suspect other types of injuries. Again, clues such as a damaged windshield may lead you to suspect that your patient has some sort of head, neck, or spinal trauma. In rear-end collisions, those are going to yield a different type of injury than head-on collisions. Your side impact collisions, or your T-bone or broadside collisions, and your rollover collisions are going to provide different types of injury patterns. As it relates to motor vehicle collisions, you can also have rotational impact collisions, which are cars that are struck and then they begin to spin. So the initial impact often causes subsequent impacts as well. For falls, it's more concerning when an adult falls over 20 feet. Child under 15 years of age, more than 10 feet, or 2 to 3 times the child's height. The characteristics of a fall can provide valuable clues to the patient's injuries. How far did they fall? What did they land on? How did they land? Again, the important factors: the height from which the patient fell, the surface that the patient fell onto, the part of the patient that hit the surface. Was it their head? Was it their feet? Did they fall completely flat? Did they hit anything on the way down that interrupted the fall? Penetrating trauma is injury that's caused by an object that passes through the skin or other body tissue. These are many times classified by the velocity of the item that caused the injury. Your low velocity, or your knife injuries, are going to have damage limited to the area that's penetrated. However, you may see multiple wounds. Your medium velocity injuries are going to be such as your handgun or shotgun, and your high velocity is going to be your rifle type injuries. You're going to see damage directly from the projectile, and then you're also going to see pressure-related damage or cavitation. Blunt force trauma is going to be injury that's caused by a blow that strikes the body but does not penetrate the skin or any body tissues. Signs are often subtle and easily overlooked, so maintain a high index of suspicion based on the mechanism of injury. Nature of illness. We want to find out the reason that the patient called EMS today. To begin identifying the nature of a patient's illness during the scene size-up, you must first scan the entire scene. Make sure that you're actively looking for any additional patients, such as pedestrians or cyclists. You may also be able to obtain information from many different sources. Many times we want to provide this from the patient themselves, but if they're unable to communicate to us for whatever reason, we may need to ask family members or bystanders. We also may have to search the scene for clues about what happened and why. Number of patients and adequacy of resources. How many patients do we have? And do we have sufficient resources on scene and on hand to care for all the patients that we have? Does the situation require any specialized resources? Do we need fire apparatus at the scene? Is this a confined space injury that we need technical rescue or a high-angle rescue? Are there any hazardous materials on scene that are going to require the additional response of a hazardous materials team? Remember that scene size-up is the first part of the patient assessment process, and it's important during scene size-up to determine what, if any, threats there may be to your own safety and to the safety of others at the scene. Then take your appropriate standard precautions. Next, it's important to determine the nature of the call by identifying the mechanism of injury or the nature of the patient's illness. Finally, you must take into account the number of patients and any other factors at the scene to determine if you're going to need additional help. Determine the nature of the call by identifying the mechanism of injury or the nature of the patient's illness. Determine the number of patients and any additional resources that may be necessary. Remember that safety is the first priority. If it's not safe to go into a scene, don't go into the scene. So for each of these dangers, think about what actions must be taken to remain safe at a collision scene. What are you going to do for leaking gasoline? What if you see or have toxic or hazardous materials that have spilled? What if the vehicle's on fire? What are you going to do with downed power lines? What are the common mechanism of injury patterns for the following collisions? Head-on, rear end, or a fall from a height? Lastly, you're called to the scene of a shooting at a fast food restaurant. While you're en route, you plan your scene size-up strategy. What actions do you anticipate taking on arrival?